Hello, it's Dr. Rhonda Johnson. Today is Thursday, June 2nd, 2022. Today I'm talking about erectile dysfunction, commonly known as ED, as a complication of COVID infection and part of the list of symptoms of long COVID. But I want to talk first about the micro level, what causes this. Well, it has to do with that virus and the receptor that the virus attaches to the cell. It's highly present in the cells of the penis and the testicles. So the virus can attach to the cells in the penis and the testicles and cause them to be infected, which causes inflammation and dysfunction. So research has also shown that, the disruption of the blood flow because of the inflammation of the endothelial cells, those cells that line the blood vessels, can cause disrupted blood flow, which can lead to changes in the nerve conduction and muscle contraction. And all of those functions have to do with erectile functionality. So research has also shown that COVID infection can reduce the amount of the male hormone testosterone produced. In one study, folks, testosterone deficiency was found in 74% of men with COVID. So there's testosterone dysfunction. There can be direct infection of the blood vessels, reducing the blood flow, altering nerve conduction and inflammation. And there can be testicular damage that results from high fever, secondary inflammation, and hyperimmune responses. So that's a lot. So how common is COVID-related male reproductive problems? Well, according to some experts, anywhere from 10 to 20% of men with acute COVID infection develop inflammation of one or both testes, or they can have inflammation of other parts of the male reproductive organs. Now, if you're a man that has other coexisting conditions that predispose to erectile dysfunction, such as obesity or high blood pressure or diabetes, circulatory disease, or neurological conditions, you may experience higher rates of ED following COVID infection. Now, I'm sure you want to know how long this lasts. Well, experts say that it can be either short-term or long-term, which basically means nobody really knows. Now, does this cause male fertility issues? Again, experts don't know yet, but time will tell. Now, experts do recommend getting the COVID-19 vaccine to lower your risk of ED as a side effect. So, closing, erectile dysfunction is part of the list of long COVID symptoms. Please see a doctor or a specialist called a urologist if you have any symptoms related to the male sexual and reproductive organs during acute COVID infection or that persist after you recover. And men, you got to be sure to tell the doctor about your history of COVID infection when you see the doctor for your erectile dysfunction. That's my message today. As always, stay safe out there and please be careful.